Welcome, everyone. So I will turn it to Dr. Wilkins to introduce our wonderful guest for today, and then we'll get started.
Thank you, Hedi. And as Hedi mentioned, I am Harry Wilkins. I'm one of the co-writers of the Art of Effective Physician Communication. And I get to present with Hedi at workshops throughout the country at different OPOs, organ procurement organizations. We've been doing that for about 7 years. The book is really a compilation of the workshop itself. And so it's a very interactive workshop, and we introduce different principles. And so with the friends, we have people who we feel best reflect those principles. And so today's topic is on love and variety, and we have Dr. Michael Moncure. So my great pleasure is to introduce my friend and colleague, Dr. Moncure. I have known Dr. Moncure for, I believe it's going on 30 years now, 27, I believe. We met in fellowship. We were fellows together in the early 90s at Shock Trauma, and wild, wild days they were. We had obviously a lot in common, being African-American physicians, fathers, sports fanatics, trauma and critical care gurus, and just really impassioned with that. And so we've kept in touch with each other over the years, even though our professional paths have taken us different places. Dr. Moncure left Shock Trauma in Baltimore, and I went to Texas, and he went to New Jersey. And then I tried to recruit him to Texas, and that didn't work, and he went to Kansas, and then I got recruited to Kansas, but we didn't work together. Now I'm in Illinois. Dr. Moncure is now at Truman Medical Center, where he's a professor of surgery and remains a great clinician, researcher, teacher, father, just a great, great guy. So Dr. Moncure, welcome.
Thank you very much, Dr. Wilkins. Thank you very much. And thank you very much, Hedi.
So to start things off, one of the things we wanted to ask you about, and also to the audience, I'd add to what Hedi said, you can have questions for Dr. Moncure, and I'm going to refer to him as Michael through this.
Please.
You can also refer questions to myself or to Hedi as well. But our guest today is Dr. Moncure and Michael, so we'll refer those to him. So I guess the first thing I'd like to ask you is, so Michael, one of the things that we talk about in the workshop, the very first tool is the 6 basic human needs. And as a physician, I always try to make a plea to people to realize that we are physicians, but we are people. And so when you relate to physicians, just remember our humanity. And the thing that we talk about in the workshop is that every human, whether it be your son, your daughter, your neighbor, your spouse, your boss, your enemy, they are humans. And as humans, they have 6 basic human needs. And that is certainty and safety, love and connection, variety, growth, significance, and contribution. And not necessarily in that order. A lot of people immediately think of Maslow's hierarchy of needs. This is actually a little different. So when we talk about those 6 things, one of the reasons, and I'll give some background on why we wanted to ask you about this, is that love and connection, and also variety. So from the first thing I guess I'd ask you is, as it relates to your profession, how do you get love and connection within your profession? I always think about you as, how connected you are with your colleagues and with your residents and with your nursing staff, because you're always posting on social media about your team and what a great group of people. Can you talk about that and what that means to you within your professional realm?
Okay. As you know, Harry, being in the profession that we are privy to be a part of, trauma and critical care, it's can be extremely demanding, and it can be taxing emotionally and physically. Right. And so I think it's probably the nature of what we do. I think in order to become as effective as possible, I think there have to be those connections and whenever I'm in any kind of role, whether it be leadership or otherwise, I feel like a team just works together as a well-oiled family. And so there are those emotional and connections as well as their commonalities, but we all have the same goal. And I think that if we all look out for each other, then that will work even more effectively for our patients. I can give you a really good example. The first job I had, not to name out names, but I had a job. I had a job in New Jersey where I basically, I was probably one of the younger members of the group, and I had a boss who was very old-fashioned, and he's a good person. But the birth of my third child, he told me that you don't need to be there. You've already seen two. Your wife is a physician. She'll understand. This is ridiculous. Just stay here at work. And I actually had one of my partners. She's from Germany, and another partner. She's from New Jersey as well. And they both just pulled me aside. They said, "Listen, you better get out of here. I've got this covered, and don't look back. And congratulations," and sent me on. And because I haven't missed the birth of any of the four of my kids, but that's something that stuck with me my entire career. That I will not let you, if you're my partner, I won't let you miss anything, much less obviously a birth, but a concert for kids, a baseball game or whatever. We'll work together, and I think that builds something within the group that creates a bond that we all feel connected, and it's a concern for each other.
Yeah, it's real interesting. In the workshops, this comes up from time to time because, there's a stereotype. I mean, you're a man, you're a surgeon, you can't show affection, you can't show tears. And I always say, I always make this comment. I said, what would happen if a doctor walked onto the unit one day and said, "Guys, I need some love and connection," and everybody just laughs because we don't say it.
Right.
We don't say it. And what I think you just demonstrated beautifully is we may not say it, but clearly we need it, and we demonstrate it differently. So by your colleagues saying, "Listen, we got you covered, we got your back," that's literally our language for
Right.
saying love you. Mm-hmm. And so I think that's a great example. I one of the things I remember about you, Mike, is that you're about 12 years old, maybe 13. I just love that infectious enthusiasm that you have for this stuff.
Right? I've been told that before.
I resemble that remark. But I think what happens is that is so infectious, that where that comes from. And one of the things I always say is that people tell me that I'm sometimes 12 years old. You give me a new toy or something to work with. And so I guess that rolls into the variety piece. Now for you, and I think yours is maybe a little stronger than mine, but talk about, in our careers, we're starting to be the more venerable people in our careers now.
Yeah.
You've seen lots of changes. When we started our training, laparoscopic surgery wasn't even a thing. And then it was. Even now, like the robot, you work with the robot now. Talk about what role variety is, particularly those types of things when a new innovation comes around. How important is that, Michael, for your career, to have engagement, to have variety?
So, and that's really important to me from the standpoint that it just fuels me and it allows me to just be energized by learning something new. It's got to make sense because my old boss, James Thomas, will tell you that initially he said, "Man, you don't have to try everything." And once I got that down, I would really look at the technology and see if it really made sense, and then I would adapt. But I get excited about that. I get excited about also studying new technology and seeing if it really stands the test of improving outcomes or if it's worth the cost. And just learning something new, I just probably feel like I'll probably do that up until retirement. I know a lot of colleagues that will just basically just step back and say, "This is what I did this is what I do, and I'm not going to learn anymore. And there'll be a time when that's going to be practical, from the standpoint of if I'm 1 year from retirement, I'm not going to learn how to do something else and take that experience from someone else. But right now, like robotic surgery, I could see the utility. I could see how it definitely helps others and our patients. And I also love teaching that new technology to others. And I love seeing the excitement and love seeing the the energy that's exuded from that. Now, that's why I really love students and I love residents, and I love just seeing them come through. I love seeing them grow. I try to keep track of them. Through the years, I tell them, you're stuck with me for life. And it's fantastic just seeing people just, doing so many great things within their careers. And I love it.
Yeah, and I think that you mentioned the word love again, but I think your residents feel that as well, and the people just by keeping in touch with the people. It's one of the things that I admire about you so much, and I think it's one of the things that makes you such a lovable guy, is that you do connect with people, and it's one of the common threads that we find among physicians that are really, really engaged.
So, Dr. Moncure, when you are dealing with new things, you obviously enjoy the thrill of the growth that comes from that. Do you also get excited about the variety of, we talk about sometimes, when somebody, what is the example, Dr. Wilkins, that you use in the workshop?
How many optometrists do you know, ophthalmologists? And when was the last time they went on and on about the last cataract they did? But if you think about doing the same procedure over and over again, that can sort of become monotonous. But then you get that one thing that's different. It's what's different about trauma, at least for me, is that thing that's different. It's that new, exciting thing.
Yeah, to expound on that, I love trauma. I still love the excitement, but I also love just kind of sitting back and kind of relaxing at the robot console and doing a case and with
it's different.
Different time frames, and the life and limb is not that risk, based on the clock. And so I like those varieties. Now, one thing that Harry could attest to, I've always got a temper, that desire and love for variety and innovation, because I can remember the time when I tried to adopt some new technology and that really didn't make it. And you can find it anywhere. And bottom line, it's good to have colleagues that are able to tell you, hey, I don't think I would waste very much time on this.
And that goes to that loving connection, right? You got to have those people that will have you back and tell you the way it is. So one of the things Hedi and I talk about in the workshops is, one of the things that OPO staff have a hard time doing sometimes is engaging with physicians. And what we propose in our workshops is that if you can understand the underlying things that motivate physicians, and you can relate to them from that standpoint, then you can engage them. And when we started this workshop, we sort of interviewed different physicians that were engaged in this OPO work, this organ donation work. And we surmised that the people who were engaged in this were attracted because it fed that need for love and connection and variety and growth and significance and contribution. What would you say would be a great way if someone was disengaged with the organ donation process? Could you think about how you could use this love and connection and this variety to engage them? What would be a way you could think about doing that?
The donation community is a really loving community. It's full of a bunch of characters that are extremely interesting, engaging, and a lot of fun.
Yeah.
You can, that may not always be said about whatever group you're in medicine or in your hospital group. And that saved me a lot in Kansas City in regards to one of my jobs, just being engaged with the organ donation community, Midwest Transplant Network, because that was my bastion for, where I work with you, and I work with Jan Finn and Lori Markham and a number of other people that their nature is to love and to actually to applaud when you do something good and to recognize. They're very tuned into that, and so that they were able, and we as physicians, we're all very much into succeeding.
Yes.
And we are very confident. And so basically, Jan and Lori sat down with me and said, "Hey, take a look at these cases. We had to walk away from this, and we just felt like there's nothing we could do with this patient. They had gone through diabetes insipidus, and they're dry, and it just seemed like too much work." And to a person, everyone that's gotten involved with us has always said, "I could turn this around. Are you kidding me? I got this. Give me a chance to show me the next patient." And you just get sucked in, and then you succeed, and you see what transpires. Someone actually significantly benefiting that could have possibly died as a result of something you do every day that you kind of take for granted, as far as resuscitating fluid, blood, ventilators, you name it.
Which is what we do.
It's what we do. And it's almost automatic. And to actually see not only one patient benefit from that, but a number of patients benefit from that, you're hooked.
Yeah.
You got us. So first of all, because we don't always get the normal relationships within our field of medicine to offer that to someone that's a physician. Second of all, to when it's due, to give them a lot of praise, because there's a void. There are a lot of physicians that aren't involved, and that enthusiasm is contagious. Because I could tell you, and I've been in three environments since I've been so much into organ donation. Even my New Jersey job, that's kind of where I got a little bit hooked in. And at the University of Kansas, we were like 20% conversion, and even Truman, we've had times when we've been 20% as well. But you just have to be patient, and you just have to demonstrate to folks, how to take care of the patient, how to take care of families, and to be transparent and demonstrate that you care, and that you tend to increase the enthusiasm of those around you. Because I can tell you, when I first got to Truman, there's no way it's 20%. We have mainly African-American and Hispanic patients, and I don't care what you do. I don't care what Lori and Jan say. No, whatever you do, you're going to be at 20%. So just live with it. We're at 80% now, and it's just one patient, one family at a time, and just being consistent, being transparent, being, making sure that those families are included in the communication, that you spend the time and you work in conjunction, because that was the thing that probably wasn't happening. Although there was probably a huddle, it was just going in one ear and out the other. Right. And so they're collaborating and being a team.
Yeah. And I think one of the things that you point out is that families are people, doctors are people, nurses are people, and they all need the same thing. So once you've shown them that love, it's enthusiastic, it's contagious. And organ donation really does represent a lot of variety.
So what I heard from you, Dr. Moncure, is a great way of engaging physicians is to ask them for their help and their opinion on, especially in the area of their expertise, but in relation to cases that they don't routinely deal with. So for example, the donation cases, as we all can agree, those are very rare cases that you deal with. And by asking a physician, it poses that variety opportunity of contributing in a case and a situation that is different and challenging. But the fact that the OPO, Organ Procurement Organization, asked you for help and said, hey, can you help us solve this? It got you, from what I heard, motivated and excited to be more involved. What are ways that you have experienced non-physician staff showing you love and connection. We talk about that physicians get their love and connection from their patients and their patients' families. But what about organ procurement organization staff, nursing staff, things like that? What are some cool ways that you have experienced love and connection as a physician?
So Harry and I can attest, I mean, no matter what our job, our career is doing at the time, it seems like that particular venue remains just constant and connected. We just have awesome people here in Kansas City. And there have been some really tough times for me professionally, but my friends, Harry, Jansen, Lori Markham, all those are always, we always have each other's back. And I always have that as a refuge, to be at a place to go. And also from a social standpoint, there are a lot of social events and things that occur for the families of our donation patients, that come back for other events. I mean, it's intoxicating to see the joy that they have, and you realize the pain that they were going through at the time in which they were making those decisions, or the decisions were being made, and they were able to see those unfold, to see someone who is from a donation family that touches someone's chest, who has the heart of their loved one and the joy that they have. Seeing them marching a rose parade or what have you. I think the first time, I mean, it's one thing to put a paper in front of me and say that I could, do you think you could turn this around? And of course I can. Yes, there's no critical care physician that doesn't think they can. But when you actually help and you work to help the donation team or the OPO team do that and turn that patient around and result in significant numbers of organs that are transplanted and function, and you get that letter that says there's a 51-year-old woman in Kansas who was on the list for 500 days and now has a working kidney, is so appreciative that she doesn't have to go to dialysis, and a person that was on ECMO that received lungs. And I mean, how could you not? How could you not be touched by that? And I think the friendships and the relationships are extremely important. Those guys know me better than probably almost anyone.
Yeah.
They know when things are going on with me, or I know the same about them, because we've been in some difficult situations and worked them out. And it's an important part of my life and my being. If I ever got a job that said, you can't do this, you can't work with this team, then I probably wouldn't take it.
So I heard you say that the way you feel the love and connection is, one, that they asked your opinion, engaged you, but also two, that they invited you to be part of special events, whether it's team events with the staff, whether it's with the donor families, and then also sending you those outcome letters of what happened after the donor case, and with, a little bit about those people who received those transplants. And we talk a lot actually in the workshop how we really mustn't forget the story of the donor family and bring that back to the physician, because the last time you saw them, they were in the worst possible state, and how to make sure that we close that loop for the physician as well. Would you agree with that?
I would completely agree with it. And I was posed with the question. We've got people that are in the palliative care community, that some of them are in that transition of thinking that this is the worst thing you could do to this family now, to pose this question, to ever talk about this. So you should just stop, move on, and we've seen that, and I've seen Harry convert people like that to true believers, because it is one thing to see someone in that hour or 2 hours where they're aggravatingly making decisions about donation if they're not a first person, and it's another thing to see them 6 months or a year later enjoy and
Mhm.
and celebration for
Yeah.
what has transpired. Because truthfully, what we do as trauma physicians in critical care, we see people. It's not like seeing someone come into your office with a huge metastatic tumor on the liver, for months and months and trying to do different things, and then they pass away. We are dealing with families that the last time they saw their loved ones, they were
Mhm.
completely fine. And they
Right.
had nothing, no maladies at all. And all of a sudden they're receiving a phone call. And then they're pulled into our world. And there's probably the worst day of their lives.
Mhm.
And so to see that happen, but also see what happens on the back end, to see them come to these conferences we put on, and who knows what town we're
Mhm.
in. And no matter what town you go to in Kansas or Missouri, we can find a donor family and they will gladly come and speak to those physicians, those nurses, those people that work in that whole process, and they will gladly testify that what you did is worth it. And
Yeah.
that is a message that, I mean, I could say it till I'm blue in the face, but until you see the letter, until you see the family telling you, I was so happy that I did it, until you actually see a family that says, the worst decision I ever made was not doing
Yeah.
it. And
That's,
that is the most painful.
yeah, and those are important things to hear. One of the reasons why we did the Fundamental Roots and Friends is people who are actually out there. There's a big misconception out there amongst a lot of OPO staff that surgeons and doctors are so busy, we don't really want to approach them with something else. And I think we lose that opportunity to engage them. What would you say to somebody that says, well, you don't want to bother the physician with these things too much? I think I can hear it in your voice, but I think for the people who might be watching this, who are OPO staff, and their reluctance to sort of maybe invite them to one of those, they're too busy to come to this event that we're having, or we're too busy to sort of bother them with these follow-ups. What would you say to them in terms of engaging them on love and variety, love and connection and variety?
That is an excellent question, Harry. And I think you are actually the person I would point to that kind of elucidated that to me, because we were passionate about it. But remember, we were in a meeting, and there was actually a critical care physician that was from Michigan, and
Yes,
and he was basically uh,
chewing our tail.
upset. He was upset that he was not involved. He said, "You guys come in, you push me out of the way. You don't let me see what you do, participate, and then you basically close the curtain, and then you don't involve us, and you don't ask us our opinions. We're basically shut out. It's just like a light switch." And he actually said he felt a resentment about that,
Mhm.
and that was something that I think that clicked for a lot of people. From the standpoint that they realize that a lot of physicians do have those needs, and although we're busy, something like this is really important. It's not something that happens every day, but when it does happen, I want to be a part of those 10 or 20 donors that are in my facility to help, because I know that that's going to be a benefit to not only the family and the potential patients, but for the entire society, taking something off the list.
Well
That
said.
is such an excellent point, because we talk a lot about, and we see a lot that non-physician staff, whether it's nursing or organ procurement organization staff, that they don't want to bother a physician any more than they need to because they're too busy. And so they feel like if they can't handle it, I don't need to bother them. But then unintendedly, they don't realize that they're creating resentment in the physician because they're leaving the physician out. And so we always say, ask the physician how involved they would like to be. Invite them into the process, ask them for their opinion, ask them, for their help. And then if they don't want to, they can say that. But I've never had a physician say no when I ask for help, because it's like kryptonite. And also, I think that's the thing, right? It's still their patient ultimately, and it's nice to see and follow that through, especially when you can tie it back with that story. When we were on a national call a little over a month ago, I think it was, and somebody shared this great idea, and we kind of flipped and translated it to physicians of, creating, especially during right now with the social distancing and everything that's happening, of creating little video vignettes from donor families to send to the physicians. How would you feel if you got something like that?
That would be fantastic. That would be fantastic. And we've heard it, especially like the pediatric community, they feel a kinship to their families and they feel a sense of ownership of that. But as much, I think if you are able to do that, then these physicians will be less likely to interfere and do things that just bombard the situation. They'll understand, they won't bring up organ donation, they won't do things that make it difficult to actually know this process to be successful. They'll tend to try to understand, the entire process and how they can interject to help. And they'll also feel a sense of a victory, an additional victory when that whole process is successful on the end of, from the standpoint of the actual recipients. And so I think all that will help to eliminate a lot of the communication problems and the resentment. Harry and I have seen, this whole thing kind of ebb and flow from, it was at a low point when we started the organ donation collaborative, but we've seen people say we should be asking for permission, for donation, early on versus just making them comfort care. And just weird things are permission to do brain death pronouncement and just weird thoughts that just make no sense. That, right. I mean, they say they're supposedly saving, the family from this pain, but I can't think of a way to make it easier than if I don't have to make a decision. If Harry comes to me and says, no, at 2 o'clock, we're going to do a neurologic exam on your loved one. I want you to be there. If that neurologic exam doesn't show that there's function, then we're going to then pronounce him dead at that time, as opposed to, what do you think? Do you think he'd want to be, going through this? And I don't think that I think he's probably 98% chance he will not be the same as he was. So what's your decision?
Yeah.
I mean, that's a lot to put on a family.
I get asked a lot, and I think it exudes love. That, I mean, if a family asks you, if this was your loved one, if this was your wife, this was your child, this was your mom or dad, what would you do? And I mean, I always have to preface it by be as sincere as possible. You also talked about a really important principle, plain spoken English and very direct language. It can't be flowery or anything. It's got to be, no, I feel like this is a situation where, just to do that as much as possible. I mean, I think that denotes that you care. Another thing I've been finding lately, and I learn a lot from my OPO community, especially the family services people, they talk about, when someone's going through things. I've been utilizing it the last several times, and it really takes this from this grave situation to actually a more human side. I was at the bedside, one of my residents, he's so good, and we're talking to this family, and this COVID situation is horrible from the standpoint, this family did not get a chance to see him until hours before we were about to do pronouncement. We pushed it off for a little while and gave them time. But asking the family members, because the brother's just torn. And I said, what'd your brother like to do? And he said, man, he loved to play soccer, but he sucked. And everyone laughed. And his mom just started laughing and said, he really did suck. And the humanness that came out of that, and they were able to then tell stories and talk about instances of that were funny about this. Then it was just like, it just lifted off of that heaviness, and it was so easy to discuss donation for our OPO colleagues later, and they were there. They were able to see that and see where the family was at that point, and so they're able to utilize that. But making someone human, not just, And I always tell them, I said, I didn't get a chance to know Joe. No, unfortunately, but fortunately, I don't feel like he's ever endured any pain, here at this hospital, because I think he's pretty much been gone. I want to know, tell me something, tell me a story about him. And that everyone lights up.
Yeah.
I haven't seen one person, start crying or make it worse. It always either stays the same or makes it better from the standpoint that we don't choose to remember that person as just lying in bed with no reflexes, but choose to remember them in life.
Yeah.
So
And
I think I've said it before, you've heard me say this, is that people want to know how much you care before they care how much you know. And that's exactly what you're talking about. And what that is that's love and connection. When a family member asks you, what would you do if this was your mother? They're trying to connect with you. And I think the better you can do that, whether it's to a family member to a doctor, or from an OPO staff to a doctor, or to a family member, that love and connection is so important. And then as you mentioned, how many patients do you see in a year versus how many donor cases do you see in a year? And you're at a fairly busy hospital. Again, it's that variety. Donation represents variety to physicians. So I think we've sort of demonstrated here in the stories that you so wonderfully told, how love and connection and variety can really engage physicians and families in this donation story. So just great stories. I think you've done a great job pulling that all together.
Yeah, awesome. So thank you everyone for participating in today's live stream. Thank you so much, Dr. Moncure, for your time and your participation and sharing your passion, and for all the tremendous work that you are doing. You're just an amazing person, and we really appreciate you. I'll turn it to Dr. Wilkins to close us out.
Yes, I will second all of that. Mike, it's been a pleasure as always, ever since the very first day we met. I'm just always, enthused and, reinvigorated. And you kind of push me to be a better doctor, that better person all the time. And hopefully you've done that for our listeners. So just really appreciate you taking the time out to join us on our Fundamentalists of Friends.
Thank you so much.
Bye, everyone.